Hello guys, welcome and welcome to Metier Academy, one of the leading academy in training nurses in the nursing competitive exam as well as IELTS and CLEX and OET training. Today we are going to discuss very important topic, and before that, welcome back to Magic Pill session. The topic what we are going to discuss today is crutch walking. So related to this specific topic, most of the time, so many questions are asked in the exam. Those who are going for skill test, for example, now you are going for, JIPMER skill test examination. For these people, this crutch walking demonstration and the questions related to crutch walking is going to be really useful for you. So please watch the video till the end. Definitely it will be so much useful for you. Okay, so let's begin the session with the motivational thoughts. Think big, trust yourself and make it happen. Have confidence, guys. Think big and trust yourself. These two things are very, very important. You should have the courage. Not only confidence helps you, the courage is also will make you to get success. Okay, so always you have to think big and trust yourself, and definitely in a good day, everything is going to get happen. With this motivational thoughts, let's start the session. As I mentioned already, the topic what we are going to discuss is crutch walking. Actually, it is part 1. There is one more video I'm going to post on Monday, that is part 2. Okay, so in part 1 we are going to cover all the important question which is related to crutch. Okay, and in part 2 we are going to discuss the important question related to gait, like 2-point gate, 3-point gate, 4-point gate, swing gate, and so far whatever the question as related to these gate and crutch, everything we are going to discuss in part 1 and part 2. So watch the video till the end. Those who are going for skill test, definitely it is going to be very useful for them. So please watch the video. Okay, fine. The introduction is going to be like this, like, crutch. What are all the parts of the crutch? What are all the types of the crutch? Okay, so with this we can start this session. So here you can see very clearly, this is the crutch. Okay, this is the crutch. Okay, otherwise we can say it as an axillary crutch. There are so many types of crutch. Actually, broadly it is classified into 3 types. We will be discussing about the types later. First, let's see about the parts of the axillary crutch. Okay, so this is the axillary crutch. It is also called as underarm crutch. This one, axillary crutch, are also called as what? Underarm crutch. Now we are going to discuss the parts of the axillary crutch or underarm crutch. Okay, so here you can see the first part is crutch pad. What is that? Crutch pad. Okay, so this is the first part. Okay, so this crutch pad is going to be come below the axilla, just below the axilla, 5 centimeter below the axilla. This crutch pad is going to be there. Okay, the second thing is hand grip. This is the hand grip where you are going to hold the grip. Okay, by making the flexion, elbow flexion, you are going to hold the hand grip. Okay, the last one is crutch tip. This is the tip, that is the lowest bottom part is going to touch in the ground. Okay, so these are all the 3 main parts of the crutch. So what are all the 3 parts? Crutch pad, it is going to come below the axilla. Hand grip, where we are going to hold the hand grip. Okay, the name is hand grip, there we are going to hold. Okay, the last one is crutch tip, which is going to touch the ground. Okay, fine. So these are all the important part of the axillary crutch. It is also called as underarm crutch. So the first point is over. The second thing, the type of crutches. Already we have discussed about the first type, that is axillary crutch. The second type is elbow crutch. This is the elbow crutch. This elbow crutch, it is also called as Lauf strand crutch. What is that? Lauf strand crutch. This is the elbow crutch. It is also called as Lauf strand crutch. Okay, fine. The last one is forearm support crutch. This is the forearm support crutch. See, image-based questions are very common nowadays. Please observe the video, observe the images carefully. Okay, so this is the forearm support crutch. It is also called as gutter crutch. So 3 types we have discussed so far. The first one is axillary crutch, also known as underarm crutch. The first point over. Second one, elbow crutch, also called as Lauf strand crutch, and third one, forearm crutch, also called as gutter crutch. Okay, so these are all the types of crutch. Okay, guys, so let's discuss about the question which is related to the crutch. Okay, as I mentioned already, related to gait, like 2-point, 3-point, 4-point swing gait. The video is going to be posted on Monday. There also we are going to discuss so many important questions along with the video, how to use the crutches, everything we are going to discuss in part 2. In part 1, the question related to crutch we are going to discuss. Question related to gait in part 2 we are going to discuss. Okay, fine. So the first question what we are going to discuss is the length of the crutch for a particular patient depends upon. See, in a simple way, I will explain this question. The length of the crutch, how to measure the length of the crutch. This is the question they are asking here. Okay, how to measure the length of the crutch. Okay, so options, what are all the options they have given here? Patient height, angle of flexion, distance between axilla and crutch pad, all of the above. Like that, 4 options they have given here. So the specific point what you supposed to remember is the length of the crutch has to be measured by using what options. So 4 options they have given here. And here the right answer is going to be option D, all of the above. While measuring the length of the crutch, we have to consider each and every options like, patient height, angle of flexion, distance between axilla and crutch pad, everything we have to consider. So let's discuss one by one in detail. See, patient height. So while measuring the length of the crutch, we have to consider the patient height. Patient height in the sense it doesn't mean that we have to measure from the head to the toe. See, we should not measure the length of the crutch from the head to toe. We have to measure the length of the crutch from the axillary region till the heel of the patient. From the axilla till the heel of the patient. Okay, so patient height means always keep in mind the height starts from the axilla and it ends in the heel of the patient. Okay, this is the first golden point. Second golden point is angle of flexion. Angle of flexion is, this is the angle of flexion. See here, you can see this is the elbow and the elbow is flexed here for holding the grip, hand grip, right? Fine. So this is called as what? Flexion. Mostly this elbow flexion is going to be 30 degree, 20 to 30 degree. Okay, if you want to come in approximate, that is 20 to 30 degree. In specific, they are asking in the exam means 30 degree is the right answer. Okay, fine. So the angle of the elbow is going to be 20 to 30 degree and the measurement is going to start from the axilla to the heel. Okay, and one more important point, the length or the gap or the space between the axilla and the crutch pad should be 5 centimeter. If they are asking in centimeter, you have to write 5 centimeter. If they are asking in fingers, 2 to 3 fingers. Okay, if they're asking in fingers, 2 to 3 fingers. The space between the axilla and the crutch pad, the gap, the space, the measurement of the space is, if they're asking in centimeter, that is 5 centimeter. If they're asking in fingers, it should be 2 to 3 fingers. Okay, guys. So these are all the 3 points, vital points we have covered. And so for this question, the right answer is what? All of the above. The length of the crutch has to be measured by keeping all these points in the mind. Okay, so the next question what we are going to discuss is, yes, before discussing, let's discuss in detail about the measurement. Okay, already we have discussed 3 important points about the measurement, that is the length, axillary space measurement, and also about the elbow, right? One more important point is there, that is, see, while keeping the crutch in the axillary pad, okay, or in the axillary gap, like this, okay, and while hanging your hand, the wrist of the hand should come in the parallel line of the hand grip. You can see here the wrist and the hand grip both should lie in the same line. Both should lie in the same line. Okay, so this is also one important point you have to keep in mind. So here you can see in this image, already this point we have discussed. The space between the axilla and the crutch pad should be 5 centimeter or 2 to 3 fingers, and the elbow should be flexed for 30 degree. Okay, and we have to wear the weight in the hand grip, not in the axilla, because it will cause axillary nerve damage. We have to bear the weight in the hand grip. Okay, and diagonally, if you are measuring from the little finger, we will be discussing in detail about this point, this last point. Okay, if you are measuring from the little finger to the tip of the crutch, it should be 6 inches or 15 centimeter diagonally. Diagonally means like this, cross. Okay, so if you are measuring from the little finger diagonally to the tip of the crutch, it should be 15 centimeter, or if they are asking in inches, means 6 inches. Okay, let's discuss that point in detail in the next question. Okay, so this is how you have to measure the length of the crutch. Okay, guys. So the next question is, yes. To ensure the crutch is fitted to the clutch, the tip of the crutch should be placed in which position? Okay, so here what they're asking in this question, the key point is the tip of the crutch should be placed in which position. You know the parts of the crutch, that is crutch pad, hand grip and tip of the crutch, right? So tip of the crutch is the one which is touching the ground, right? Fine. So here they are asking the tip of the crutch should be placed in which position? Which position? Okay, let's see what are the options they have given here. Four options they have given here: 1 inch lateral and 6 inch anterior to the foot, anterior to the front of the foot. Okay, 1 inch lateral means in the side, that is lateral. Okay, anterior means in the front. Okay, let's see. I will show the image so that it will be easy for you to understand. Yes, see, always you have to measure and keep the tip of the crutch in the ground. Okay, so how to measure the tip of the crutch? See, this is the little finger. You can see this is the little finger, and here also there is a little finger. From the little finger diagonally 6 inches. Diagonally 6 inches. Okay, diagonally means what? Cross. Okay, from the little finger diagonally 6 inches. From the little finger diagonally 6 inches. Okay, and this is the center point. You have to mark imaginarily. Okay, from here to here again 6 inches, again from here to here 6 inches. See, if they are asking in inches, you have to say it is inches. If they are asking in centimeter, you have to give the answer in the centimeter. Since 6 inches is equal to 15 centimeter. Okay, so once again I will repeat, from the little finger diagonally 6 inches or 15 centimeter, and from here to the center point again 6 inches or 15 centimeter. So this is the place where you supposed to keep the crutch tip. Okay, this crutch tip has to be kept, okay, in this region. So diagonally from here to here 6 inch, from here to here 6 inch, here to here 6 inch, here to here 6 inch. Is that clear, guys? Yes, fine. So 6 inches is equal to 15 centimeters. So if they're asking in inches, you can write in inches. If they're asking in centimeter, you can write in 15 centimeter. Okay, so this is the main thing what you supposed to keep in mind. Okay, so this tripod position is called as crutch stance. C-R-U-T-C-H. Crutch, S-T-A-N-C-E. Crutch stance. In the exam, if they are asking, crutch stance means it is nothing but this tripod position is called as what? Crutch stance. This tripod position has to be measured from the center to the periphery. Okay, so it should be in a diagonal, that is tripod, like a triangle. Okay, it is also called as what? Triangle or tripod position. Okay, so from how to measure it? From the little finger 6 inches diagonally, from the little finger 6 inches diagonally, and you can make the imaginary line. Okay, so if you are measuring from here to here 6 inches, here to here 6 inches, again from here to here 6 inches, and the last this one also 6 inches. Okay, so this is how you have to measure it. Okay, guys, fine. So for this question, it is little different. Actually, in this question, they are not asking the diagonal direction. They are asking the lateral and front direction. What is that? The lateral and front direction. Here you can see from the little finger in the lateral, this one, how much centimeter it should be or how much inches should be. From the little finger to the lateral, how much inches it has to be. Okay, and from the little finger to anterior, how much distance it has to be. So this is the question. Lateral and anterior, what is the distance? This is what they are asking here. Okay, lateral and anterior. Lateral how much distance and anterior how much distance. So this is the question what they are asking. So here you can see 1 inch lateral and 6 inch anterior, 2 inch lateral, 6 inch anterior, 6 inch lateral, 2 inch anterior, 6 inch lateral and 2 posterior to the foot. And here the right answer is 2-inch lateral and 6-inch anterior to the foot. That is option 2 is the right answer. How I have selected option 2. You can see here from the little finger laterally 2 inches and in the anteriorly 6 inches. Laterally 2 inches, anteriorly 6 inches. Okay, so that is the right answer. So you have to measure laterally 2 inches, anteriorly 6 inches, then this point will come. Laterally 2 inches, anteriorly 6 inches, so that this point will come. If they're asking in diagonally, that is 6 inches, 6 inches, 6 inches. But if they're asking lateral and anterior, means laterally 2 inches, anteriorly 6 inches. Okay, guys. So this is how you have to understand the question. Okay. So for this question, which is the right answer? Option B, that is 2-inch lateral and 6-inch anterior to the front of the foot. That is the correct placement of the tip of the crutch. Okay. The next question is, in axillary crutch walking, the weight of the client should be supported by. See, the weight of the client should be supported by hand grip, axillary pad, both hand grip and axillary pad, and by injured leg. So where the weight has to be beared? This is the question. Okay. See, whether the weight has to be beared in the axillary region, or the weight has to be beared in the hand grip, or the weight has to be beared in the leg. See, actually speaking, the weight has to be beared in the hand grip. Okay, the weight should not be beared in the axillary area. If the weight is beared in the axillary area, means axillary nerve damage will take place, paralysis of the hands can take place. So in order to avoid that, the weight has to be beared in the hand grip. This is the right answer. Okay, fine. This is the elbow crutch. Okay, fine. So here the right answer is what? Option A, that is hand grip. The next question is, in axillary crutch, the elbow flexion should be. Most of the time students are making the mistake here. They were going for 15-degree angle, 10-degree angle, 20-degree angle. So what is the right answer? Here you can see 90-degree, 40 to 60-degree, 20 to 30-degree and 15-degree. Okay, so here the right answer is going to be what? Option C, that is 20 to 30-degree. The axillary crutch, the elbow flexion. What is the elbow flexion? Here you can see this is the elbow flexion. This is the elbow flexion. This elbow flexion should be 20 to 30-degree. And in most of the books, if they are asking exactly, means you can write what? 30-degree. Elbow flexion should be 30-degree. Okay, if they are asking in approximity, that is 20 to 30-degree is the right answer. Okay, the next question is, elbow flexion for crutch walking is measured by. Elbow flexion. See, elbow flexion, just now I said it is 30-degree, right? So how you can advise the patient, this is the 30-degree. How you can give the education to the patient? We should have some scale for measuring the 30-degree, right? So what scale we are using for measuring the 30-degree angle? So this is the question. Okay, and what are all the options they have given here? For measuring the angle of the elbow, what are all the options they have given here? Tonometry, goniometer, aneroid meter, and flexion meter. So like that, 4 options they have given here. For measuring the elbow flexion, the right answer is going to be what? Option B, that is goniometer. What is that? Goniometer. Okay, guys, fine. So I have given the images, 1, 2, 3, 4 images I have given. So among these, which is goniometer? Which is the one which is used to measure the elbow flexion? Here you can see this is the goniometer. Okay, this is the scale called as goniometer, which is used to measure the what? Elbow flexion or elbow extension. Okay, guys, fine. So this is how they will be keeping and measuring the 30-degree angle for axillary crutch walking. Okay, so image based question, this is the goniometer. And what about this one, guys? This is nothing but tonometer. So tonometer is the first option. That's why I have added this image also. Tonometer is the one which is used to measure the intraocular pressure, that is 10 to 20 mm of mercury. And the next one is aneroid manometer. It is nothing but BP apparatus. Okay, so here you can see the aneroid sphygmomanometer, and there is nothing called as flexion meter. So just blindly they have given this option, flexion meter. Okay, so for measuring the elbow flexion for crutch walking, the right answer is going to be goniometer. So the image is given here. Okay, so far what are all the questions we have discussed? We have discussed about the parts of the crutch. The second one is the types of the crutch. So we have discussed totally three types of crutch, right? So what are all the three types of crutch? Axillary crutch, it is also called as underarm crutch, elbow crutch, forearm crutch. Forearm crutch is also called as gutter crutch. Elbow crutch is also called as lobster crutch. Okay, and how to measure the length of the crutch? You have to measure from the axilla till the heel of the patient, and always you have to maintain 5 centimeter or 2 to 3 fingers gap between the axilla and the crutch pad. And very important thing is elbow flexion, that is 30-degree elbow flexion has to be maintained, and the weight has to be beared only in the hand grip, that is this is the hand grip, and this hand grip can be adjustable. Okay, how you can measure the elbow flexion? By means of using the goniometer. Okay, and diagonal. See, diagonal is very important question. This question asked so many times in the exams. Okay, so you can see if they are asking the measurement diagonally, always you have to measure from the little finger diagonally 6 inches. The little finger diagonally 6 inches. If they are asking in inches, you have to write 6. If they are asking in centimeter, you have to write 15 centimeter. Okay, fine. Suppose if they are not asking in diagonally, if they are asking lateral and anterior, means from the little finger laterally 2 inches and anteriorly 6 inches. That is the right answer. Okay, so this is the placement of crutch tip. That's it. So the next one is, so weight bearing already we have discussed. We have to wear the weight only in the hand grip. Okay, and the next one is axillary crutch. The elbow flexion should be 30-degree. This also we have discussed. And the last point is elbow flexion for crutch walking is measured by goniometer. This is the scale image based question. Okay, and this is the tonometer, and this is the aneroid sphygmomatometer. Okay, so if you have any doubts anywhere, you can drop your message in the comment section. Once again, I'm repeating, this is only part 1. We have discussed so far only simple question, scenario based, and the video based question is going to be there in the part 2, which I'm going to post in the next video. So please watch that video also. Definitely these two videos are going to be helpful for your upcoming skill exams. Okay, so thank you very much and all the best for your exams, guys.